Okay, today's April 21st, Friday. My last documentation yesterday. I was supposed to get a call back from the office manager at Pulaski Animal Hospital. Her name is Cheryl Drasky. Drasky's her maiden name. I'm not sure if she's married. If she is, I don't know what her married name is. But this is an office manager that I've had problems with in the past, and for whatever reason, she chooses not to accommodate clients with answering simple questions concerning their pet's health is beyond me. Now I'm assuming this stems back between her and I, going back years, regarding matching prices for my pet's health care. They had to have heartworm medication that I buy for them, or was buying for them seasonally. And I want to say that at the time they were matching prices on competitors. So I asked, there's if they can match one pet company's price for this heartworm medication, and she did. And I did this for like 3 seasons. By the 4th season, I think she said that she's no longer going to do it because they're in the business of that's not their business of matching prices anymore, or something to that effect. So after that point, when it came to finding out information on certain procedures, or what I should do on taking care of my pet, I would call them and ask them questions, which I would think it's no skin off their nose just to answer my questions. But as time went on, I noticed her actions when we interacted were less than friendly, or social, not, I don't know what the word I'm looking for. So my dog, my girl, is terminally ill, and I noticed that she was suffering with labored breathing, and I called, now it's like maybe 4 days ago, to find out, because I sent them a video to see if they can give me advice. Now, Hippie's regular doctor, I know he's busy, and I didn't want to interrupt him, so I asked for Cheryl. Now, Cheryl has access to my girl's files. Sending the video, she would be able to tell me, because she's been an office manager for quite some time. She never returned. When I called the receptionist, or her name is, I know it was Maria because I recognized her voice. I asked if I can speak with Cheryl. She says, "Hold on." Now, in the past, every time I asked for Cheryl, pretty much every time, she's busy, but she'll call you right back. I have more times that I've heard that song and dance and not gotten a response from her, more so than her actually calling back and answering my questions. I've had conversations with her where she, I made a comment this is, I think, sometime last year, that I was grateful for what she did, for finally taking my call, and I said, "Thank you, you're not going to regret this." Her response to me right there and then was, "I'm already regretting it," and she hangs up on me. Now, I was at a friend's house when this conversation took place. My friend, she's an elderly, she's my Christian sister. I had to put my conversation on loudspeaker so I can hear her, because her caregiver was doing some work and I couldn't hear her on the phone. So my Christian sister heard the comment that she made, and I could tell by the expression on my Christian sister's face that she was taken back by that comment, as as well as I was, but that wasn't my concern. My concern was my pet. Now, I called yesterday, after 2 days maybe, of waiting to see, whether or not she looked at the videos. And I even told Maria that it was not just I have another girl that's terminally ill. She's not doing well. I informed Maria that Hippie is, having a hard time breathing as well, and I need to ask for Cheryl's advice. And I told her it wouldn't just take maybe a minute or two, just to get her input, and that's all I wanted. And if Cheryl said, well, you have to discuss that with, maybe you should discuss that with your doctor, then that should be something that should be said. And then I would have said, well, when the doctor is done at the end of the day, well, at this point, I don't want to wait till the end of the day. But, if that's what it takes, at least I know we can set something up where hopefully she's not suffering till then, and I can bring her in and say my final goodbyes. And I told this girl, Maria, about both the girls and the video, for one, and she puts me on hold, comes back about maybe 20 seconds later, 25 seconds later, and says, Cheryl's busy. Well, I could have anticipated that answer, because that's the answer I'm always getting. So I said, okay, can you tell, would you let her know that the videos are in their mobile number cell phone that I sent it to? She goes, okay, she'll call you in a few minutes. That was her exact words. She'll call you back in a few minutes. And I asked, and I asked her, did she, later look at the videos? And she said, yeah, she did see the videos, but she'll call you back in a few minutes. That call never came, and I waited. Last night, today's the day I'm going to have to put Hippie down, because she was struggling with breathing. She couldn't catch her breath. And of course it was in the evening, but the point is, my pets, anybody's pets, are sick. And if you're a parent of a pet and you are seeking information or help, if somebody at that clinic, because it's not a hospital, it's a clinic. I don't know why they refer to themselves as a hospital, because that's misleading. You should call back. This is not, and if there's some sort of animosity between, that Cheryl has about me, well then, you know what? I don't care. I'm not calling to have tea and crumpets with you. I'm concerned about the well-being and the care for my girl. I don't drive. I have to depend on someone to get me to where I need to go, especially when it comes to care for my girls. Now, I'm going to call and find out why she didn't call me. If you look at the Google reviews, especially the 1-2 star ratings, all of them pretty much all of them, not all, but pretty much all. The negative reviews are no callbacks, no return calls, and there's quite a few, that address the manager there. I'm being rude, just being rude. That's Cheryl Drasky. So I'm going to see what their excuse is now, because I'm going to bring Hippie in, and this is an emergency. This is something that you can't just say, oh wait, you have to make an appointment for her. She's been a client there for over 14 years. If you get patients today, if you get a bunch of people in there that have their pets for either vaccination shots or hot flushes or whatever, something that's not considered life-threatening, this is something different. This takes priority, and as an established client, you need to take care of your people. Take care of your client's pets, especially, they're the ones that are, paying your way. So let's see what they say. I'm guessing that they may not pick up because I'm pretty confident they have caller ID, and if they know the number, they won't pick up. Or if they do, they may realize they shouldn't have picked it up. They'll disconnect the call, and that's happened to me quite a few times. Well, all right. So let's see. I was up with Hippie till 3 in the morning trying to comfort her. I was crying because I thought she suffered. If had Cheryl called me right when she said she would, she could. I'm hoping she would have said, you know what, yeah, let's, it's time for her. Or if she said no, she seems okay, let's hold off. That's fine. But I didn't get anything. Again, this is not the first. Numerous times with Cheryl. Doctors, they return the calls. I have no qualms with that. There's times that I've missed my doctor's calls, but that's because either I didn't hear the phone ring, or I didn't have my phone on me at the time. But the doctor always leaves a voice message, so I got no qualms with that. It's the office manager and some of the staff members that work there about making broken promises of calling back when they don't. If you can't make the call back, then either leave a message on my voicemail and say, listen, we weren't able to get the information you're looking for. We'll try getting it for you tomorrow, and we'll call you back. That's all you need to do. Not just leave people hanging and waiting and having their pets suffer for an answer. I'm livid. I'm beat. And I'm watching my girl right now, but I'm gonna, after this call, I'm gonna have to take her in. Alright, I'm shaking right now. I am shaking.
Pulaski Animal Hospital, can you please hold? I'll be right with you.
Sure.
Thank you. AHA standards when we come back. Pulaski Animal Hospital provides orthopedic surgery to our patients. To combat post-operative pain, we offer comprehensive pain management to keep your pet comfortable while on the road to recovery. For more information on orthopedic surgery, ask one of our trained staff members when we return to the line. Do you have insurance for your pet? Don't let unforeseen financial situations decide the outcome for your pet in critical situations. Pet insurance covers most of these circumstances, and it's much easier to make these decisions when finances aren't an issue. At Pulaski Animal Hospital, we don't want your beloved pet to suffer due to an accident or sudden illness. We accept all major credit cards and have financing available through an outside agency. Ask one of our trained staff for more information about these programs when we return. Follow Pulaski Animal Hospital on Facebook to receive the latest information regarding new products, helpful hints, and featured posts on our staff. We also post any special holiday hours we may have and welcome photos of your pet. Like us now. Spring has sprung. Fleas, ticks, mosquitoes, and other parasites become more abundant as the weather heats up, and they can create issues ranging from skin irritations to anemia or even heartworm disease in your pet. Year-round use of monthly preventatives can greatly reduce your pet's risk of contracting diseases from parasites. Ask one of our team members about our preventive options when we return to the line. IDs, please. Pulaski Animal Hospital wants to make sure your dog or cat has proper identification. If for any reason your pet escapes and gets lost, an ID tag and or a microchip can be a lifesaver, increasing the chances that your beloved four-legged friend will be returned to you. We'd like to remind our valued clients. Thank you for holding. How can I help you?
Hi, is this Maria?
Yesenia, yes.
Yesenia. Hi, Yesenia. This is David Ortiz. I'm Hippie's, dad. Okay.
Yes.
Okay. I need to bring Hippie in to have her put to sleep. All right. I'm gonna say something. Okay. I spoke with Maria, the one she wears the black scrubs. I told her that I had sent a video 3 days ago to your mobile number, and I asked if Cheryl could take a look at them to let me know if this is time because of their labor breathing, both Hippie and Misha. And I even specifically mentioned Hippie. She told me she would have Cheryl call me. Cheryl never called. Finally, after 2 days, I called yesterday, and I said, can you tell me if Cheryl even looked at the video? She goes, well, let me go get Cheryl. She comes back and says Cheryl's busy right now, but Cheryl says, yes, she did look at the video, and she'll call me back in 3 minutes. She never called. Again, last night, Hippie, I was up with her all night. She could not breathe. She was labored breathing. She was struggling to catch her breath. This is it. So I want to know why Cheryl, again, has not returned my call. I don't know what it is with her, but Yesenia, I know you guys are in the business for caring for pets. I don't know why she can't even, a simple thing as give me advice about what to do for my Hippie and Misha. More so Hippie, because Hippie's got a tumor and she's got toxins in her blood and her kidneys are failing. That alone is priority, I would think, for a patient, for not me, for my girl. So I need to bring her in, and I need to, I need to speak to Dr. Spencer about this, because this has gone too far, gone on too long, too far. This is unacceptable. I don't know what her problem is, but I'm gonna deal with it one way or another.
Okay. Now with Hippie and Misha, when did you want to, or you wanted Cheryl still to call you back?
No, come on, you can. Well, first of all, I want to know why she never returned my call. This is. I'm done with Cheryl. I am done with her. I want to bring Hippie in because she suffered. When can you? I mean, as soon as I can. Within. Let me. All right. Let me go get talk to my neighbor. I'm going to see if I can bring her in within the next half hour, and I'll call right back. Please. Do you guys got caller ID?
I'm sorry?
Do you have caller ID?
We have caller ID, yes.
Okay. So that may explain why some of the times Cheryl doesn't want to return my call. Okay. All right. Thank you. All right. I'll call you back, Yesenia. Thank you.
No problem.
Thank you, Chuck. Bye. Bye. Oh, I'm sorry. I left the video running. Okay, I was talking to my neighbor Chuck. I don't think he could have heard me, but he's taking this car in probably within an hour, 12:31 or 12 or 12:30. So I'm going to call them back and say I'll be there by 1 or sooner. Let me show you. Hippie's over there. She was up from 11 p.m. last night. I was up with her all the way till about 3:30, quarter to 4. She could not. She was just struggling to breathe. I don't know what your problem is, Cheryl. If you can't call anybody when they ask for you, then have somebody call me that knows what, because and I'm addressing Pulaski Animal Hospital. When I call, or when anybody calls, they call because they have a problem with their pets. They're seeking, medical attention or medical advice from you because you're the professionals. All these negative 1-star, 2-star reviews regarding no callbacks or the office manager being rude and belligerent is unsatisfactory. You said you were going to call me back in 3 minutes yesterday. And during that time of not getting my call back that you promised, that Ms. Maria said that you would call me in 3 minutes, my girl's suffering. I can't take him to Hinsdale. I don't know why you would suggest that when I told the girl, I can't see, my head's just like this. All my thoughts, I can't even get my thoughts together. But when I called and I told the girl, I'm going to have to bring my girl in to put to sleep, you're going to say, go to Hinsdale emergency room? Hinsdale is over 45 minutes from where I'm at. And that's if somebody knows how to get there, and if the traffic is slow. If it's busy, you're talking almost an hour, if not more. Dr. Spencer, I'm going to tell you, you're a great guy. I have nothing but high regards and respect for you. But there's a cancer in your establishment, and that cancer needs to be removed or addressed. If you're looking, I know you're reading all these reviews because I see you responding to the 3-star and 4 stars, but I don't see you responding to the negative ones as much. I don't know why, but that's nothing. That's not my concern right now. My concern is the problems I'm having with Cheryl. Now, I'm going to tell you, it's unprofessional for any staff member to address a client in a manner of when, for example, as I stated in my documented videos for myself, that one of the conversations I had with Cheryl was, I made a comment like, I was grateful that she was doing this for me, and I said, thank you, Cheryl, you won't regret it. Her response was, I am already regretting it, and she hangs up on me. And she did. She did it in front of my Christian sister. She heard her comment loud and clear. It was, no doubt of what she said. When I was thanking her for all the years of service of tending to my girls, and I said, listen, I know, I might aggravate you when I call about Hippie and Misha. What's Cheryl's response? Yeah, you do. Yeah, you aggravate me. Real good. Real good. Again, it's obvious by these comments that she has some sort of animosity towards me. Because, why? I'm thinking because I have to call to ask questions about, what I should do, or finding out my test results. And that's another one. I called when Misha was diagnosed with renal failure. I brought her in on a Friday. I was told Monday I'd have my test results. I called Monday. Couldn't get my test results. The doctor, I think it was Dr. Collada, wasn't in that day, so I waited till Tuesday. Didn't get my test results. Wednesday, couldn't get it. So I asked the girls, I said, listen, can you have Cheryl maybe call me and tell me what the test results are? We'll let Cheryl know. We'll have her call you. I called again. Well, she never called. Cheryl never called. So I called again that following day. And I asked the girl, I said, listen, Cheryl never called. I'm waiting to find out what the results are from Misha. I asked the girl, can you give me the results? I know you have access to her files. Most likely, the test results are in her files. Can you tell me? She says, no, I can't do that. You have to speak with either Cheryl or the doctor. I said, all right, how about Cheryl again? Didn't get it. So the day, ended up Friday, finally getting it. They asked me if I wanted to talk to Cheryl. I said, no. I want to speak to Dr. Collada. I had to wait 4 days, 5 days, to get the test results to find out that Misha has renal failure. That only 25% of her kidneys were functioning. I had to wait 5 days. Cheryl knew why I was calling on that particular time for test results. She knew that it was concerning her kidneys. Now, whether or not Cheryl looked to see what they were, but I know that the girls informed her that I was calling for her test results. I gotta put my girl down now. I would have put it down sooner had Cheryl just picked up the phone when she looked at that, and I'm sure she looked at it that day that I sent them. My girl wouldn't be suffering. If I had a car, if I drove, I wouldn't be bothering to call Pulaski Animal Hospital. I would take her someplace that would take her in right away. And yeah, Cheryl, yeah, you did accommodate me through the years. You made that perfectly clear, and I acknowledged that, and I thanked you, and I thanked Pulaski Animal Hospital for the service and the kindness that you provided. But now that I know that it's not because of my pets, it's because you just don't want to deal with me. Well, I wouldn't have to be calling every day if somebody would return my call as I am promised. And yeah, after days of not getting a call back, yeah, you can expect your clients maybe getting a little agitated and ticked off and upset, and you shouldn't expect that, because you make a promise and you break it. Expect some recourse, some feedback on that. I don't know why you call yourself a hospital. You're not. You're a clinic. Well, just say you're a clinic. I mean, is saying Pulaski Animal Hospital a way of just trying to get people to come in? Because people are under the impression with the term hospital as a 24-hour facility. Most people, myself included. Now that I know that you're not, and Dr. Spencer clearly specifying in some of his reviews that they're not a 24-hour clinic. Okay. Then please call yourself a clinic. Don't call yourself a hospital. Okay, I'm continuing this video documentation on my desktop computer. On my cell phone, I just can't seem to keep my hand steady right now. On the 17th of April, I'm going to reiterate what I had probably said in a couple other past videos concerning Pulaski Animal Hospital and the lack of response and responsibility from that institution. It's not a hospital, it's a clinic. Both my girls are terminally ill. Well, Hippie was. There was nothing they can do with her tumor and her kidney failing. But there was ample opportunity to address her medical issues and to determine whether the pain medication that Hippie was being given was sufficient enough for the problem that she had. Monday morning of last week, April 17th, I was awoken by Misha having like a really bad violent spasm in her rear haunches. It wasn't the type of leg movement when a dog sleeps with, like they're running because they're chasing something. This was something far worse. This was like jerking, like it wasn't like a convulsion. It was almost, well, yes, like a convulsion, no, like a convulsion. But it was her back end just jerking uncontrollably. I sent that, I recorded everything. I knew that Pulaski Animal Hospital wasn't open yet, so they got a mobile number that you can send photos or videos, about whatever is affecting your pet, and they can analyze what you send them. I sent it to them at the photos or the video at about 8:30 in the morning. I know that they weren't there yet. They don't get there till before 9, and they open at 9. I then called Pulaski Animal Hospital later, about a little after 9, when I knew they were open, and I didn't get a response at first, so I called right back shortly after. Then someone picked up the phone, and I told them, I said, I know Dr. Collade is not there, because usually he's not there on Monday, because I can never get a hold of him on Mondays. I said, Cheryl there? Yes. Could you do me a favor, have Cheryl take a look at these videos, because I don't know if this is something I should be concerned about. I was concerned, but maybe, since she's been working in that clinic, I am mad right now. I'm really, really mad. She would be able to tell me, is this something that you've seen in the past? If not, if so, what do I do? If not, then what do you suggest? Do I bring her in? I was going to ask her if she has a doctor that's available to see her, because I know Dr. Collada wouldn't have been there on Monday. The girl goes, let me go get her and ask her to take a look. And no, I'm sorry, she didn't say to go take a look, because at that point, no, she didn't say to go take a look. I asked if see, I'm like this already, look at my hands. Asked her if she was available. She goes, let me go get her. I wait probably less than 15 seconds, 20 seconds. She comes back, she goes, well, Cheryl's on the other line right now. She'll call you back. Okay. She never called. I tried calling again, I think later that day. I'd have to check my phone record, I'm sure I did. I still didn't get a response from Cheryl. I waited till Tuesday. Still no response from Cheryl. Wednesday, no response from Cheryl. Now I'm still monitoring her. These spasms still going on, but I'm now really focused on, making sure that these girls are not, in any type of duress. Throwing in my head, okay, should I give Hippie more? Because at that time, I could see Hippie was struggling, And I didn't know. They said give her pain medication once every 24 hours. I knew she was in pain, and even though she was on the medication, she was still in pain. So I was like, do I give her another pain pill, even though it's not 24 hours? If I do, is this something that's going to happen? The whole entire time. Oh, Cheryl calling. So I call again Thursday, and I asked the girl. I said, "Listen, my pets, there's are in in a bad way right now." I said, "I need to speak to Cheryl." The girl goes, "Let me go get Cheryl," and I'm like, I was gonna say no, but she disconnected. She put me on hold before I could say I didn't want to talk to Cheryl. Of course, in my mind, I'm already playing in my head what this girl's going to tell me. That Cheryl's busy and she'll call me back. Sure enough, that's what the girl does. Oh, Cheryl, call you back in 3 minutes. She's doing something right now. And I said, 3 minutes? She goes, yeah, 3 minutes. And this was Maria, the girl with the black scrubs. Cheryl never calls. Never called. I waited, and I'm probably called again. I don't know. Right now, everything's going through my head right now. I gotta go pick up Hippie's remains. So I can't even put my words together, think straight right now. But the girl said she'll call you back in 3 minutes. Never called. Now, Thursday morning, I had this dream. After I took, Hippie was struggling with her breathing, and she had jumped out of bed, and she kind of like made her way down the ramp real quick. I knew something was wrong. I said, Hippie, do you have to go to the bathroom? Let me get dressed. I take her outside. She goes, and she's just panting. So I bring her back in. She gets back on the bed, and I'm just like exhausted. I lay down next to Hippie, and I fall asleep. Now this, right away, I don't dream. I very rarely dream. For that short time that I think when I got back into the bed after I took Hippie out, it was 6:40, 6:50, somewhere around there. I went to bed, and I had this dream. In my dream, I'm laying down in the bed, and Hippie, or Misha, needs to get up. And she gets up, and she, wakes me because she lays next to me. I know when she gets up. And I open my eyes right away, and I'm thinking it's Hippie, that she has to go to the bathroom. And Misha's looking at me, and I go, do you have to go to the bathroom, hon? And she just kind of like walks real slow, like something's bothering her back end. And she walks, gets down, and makes her way slowly down the ramp. As she does so, normally Hippie lays in front of her. Misha would have to go around Hippie. Hippie wasn't even on the bed. And I looked, and I figured, well, if I'm going to take Misha, I'll take Hippie out. And I called for Hippie. And I go, Hippie. I couldn't find her. She was gone. And I thought maybe Hippie, because of what was going on inside of her, was laying on the floor again, because that's what she's been doing. She's not on the floor in my dream. I look everywhere. Are you okay, hon? Make yourself comfortable, hon, because be careful. Hang on. So, in my dream, Misha, see, she's leaking, and she's sniffing where she's leaking. You can see. Yeah, I can see there's pus coming out of her personal area. All right, go ahead, baby. Just lay down. Lay down. I'm gonna have to change the bedding. Okay. Are you okay, babe? She can't even lay down because I think she's in pain. Look at that. Now, another thing I told Yesenia. All right, getting back to my dream. I'm sorry. See, I'm getting off everything. In my dream, Misha goes to the bathroom door. The bathroom door is closed. And she stands there. It's just staring at the door, even though she can't see because she's completely lost her sight. I open up the bathroom door and there's Hippie laying on the floor by the by the inside of the bathroom door. And she just looked so sad. And I go, Hippie, what's wrong, hon? And Hippie just looks up at me, slowly gets up, and as she gets up, I notice on the bathroom floor, there's blood on the bathroom floor. I'm like, oh my God. I go, Hippie, what's wrong? And I thought maybe because somehow she got in the bathroom and the door closed behind her. It wasn't me. I thought maybe she was scratching at the door to get out, and the blood was from her nails. I looked on the door in my dream. There's no nail marks, but Hippie's gone. I didn't see her leave the room, the bathroom. I look back at the floor, and then I see Misha going and laying exactly where Hippie was on the blood. Laying right on top of him. And at that point, I think in my dream, I was like, oh, no, hon, get off of there. And then, boom, I wake up. Later that night, Thursday, and after that dream, that's when I called again, and the girl says, Cheryl will call me in 3 minutes. By that time, later that night, Hippie was going into extreme duress with the breathing. I could tell, to touch her, she would jerk away as if she was in pain. In pain. I laid with her from 11 p.m. Thursday night all the way. I was up till a little after, either just before 3 or a little after 4 with Hippie. That girl did not sleep at all. I was on the phone from 11 o'clock to maybe 2 or 3 in the morning with my Christian brother, because he's up in the night and he sleeps during the day, and I wanted to have somebody with me because I was freaking out, and I was describing him what was happening, and I thought this was it, because Hippie was panting so heavily and going like that. I thought for sure this was it. I'm gonna watch my little guy. Sometime after 4, I must have fallen asleep. I fell asleep. By Friday morning, by morning a.m., I could tell Hippie she was in such a way that there was just no way she was going to make it. And all that kept running through my head is, I sent these videos on Monday again. Now this is a problem with the office manager at Pulaski Animal Hospital, and not just them, her, other staff members that say that they're going to call you, but they don't. They never do. And when I try to call, if I get a hold of somebody, they always ask, oh, what's a good callback number? Well, I get so frustrated because, every time I call, I leave my number. Don't you guys keep it on record? And the response I would get would be no. Well, then I found out that Thursday when I called about the video, if the girl sent it, they said, well, and the girl could tell that I was really upset about this. She then says, well, is this a good number for you? 7070 blah 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 blah. And right away I'm like, oh yeah, but, and then it dawned on me. I said, wait a minute, do you guys got caller ID? And the girl kind of hesitates and says, just like that, yeah. And I said, then why? I said, why isn't my number being saved in your system? Why do you have to ask all the time? And she goes, well, I'm in your file right now, and I see your number. It's in the girl's file. So all this time, when I called there, they know who's calling, and because I call persistently to find out, and I called to also remind them, to let them know, like, listen, I called early this morning, please, can the doctor call me before he leaves, or can Cheryl give me a call so I can talk to her about whatever I need to talk to her about. They know when you call, who's calling, and a lot of times my calls will go unanswered. It goes directly to their voicemail, or the phone will ring once or twice and then it disconnects. That's happened to me quite a few times. As a matter of fact, one time I called, the phone rang twice, it disconnected, and I thought that was odd, so I called again. It rang once, disconnected. It happened 3 times in a row, and that's when it dawned on me. They're hanging up. And I had a suspicion that they know who's calling. This is supposed to be a place where you can trust that your pet, your beloved 4-legged family member, gets the top rate that they claim, care that your pet deserves. Well, the apple doesn't fall far from the tree. If Cheryl doesn't want to return calls, what kind of example, as an office manager, are you setting for your staff? Because apparently your lack of responding is rubbing off on them, because they're not returning calls either. Not all of them. There's just one, maybe 2, that had made promises to call me. Maria with the black scrubs was one of them. She even, when I asked to speak to Cheryl, she said, all right, I'll have Cheryl call you, but if she doesn't, I will call you before the end of the day. She didn't. That could have been Thursday that I spoke to this Maria, and when she said that, right now I'm not sure, but I know it was Maria with the black scrubs because I recognized the voice. I saw that on my phone. Look at this. She's in pain. When I took Hippie, and after she was put down and she was pronounced legally dead, when I was done crying, I came out of the room, and I looked down the hall, and who should be standing at the end of the hallway? Cheryl Pulaski. And she's just standing there looking at me. And she waves and says hi, like that. I don't want to tell you what was going through my mind at that moment. But I think my look said it all. And I'm not going to say it, I just turned. I was so disgusted at looking at her that I walked back in the room. I would not have probably been at that spot on a Friday that day if somebody with a sense of responsibility had looked at the videos. Now, Cheryl had. I was told Cheryl had told Maria that yes, she did see the videos and that she would call me back in a few minutes. So that tells me she either. I'm gonna say that she saw it Monday because I made it clear that there's videos there, and it was right after 9 a.m. So I don't remember who I spoke to. I know I didn't ask, but it can't be too hard because whoever you got working there who's answering phones at 9 in the morning, you just ask them, which one of you spoke with me? So Cheryl looked at those videos Monday. And if she didn't Monday, then Tuesday. And if she didn't Tuesday, well then that tells me lack of concern. But I'm going to give her the benefit of the doubt that she looked at them on Monday. But still, she did not call. Maybe if she had called her when she looked, she could have advised me to, even though Dr. Collada wasn't there Monday, bring her in, or we'll see if we can set up an appointment for you to come in Monday or Tuesday, maybe even Wednesday. I don't know if I would have even wanted to wait that long. Because at this point, I don't care if it's Dr. Collada or Dr. Christie or even if it's Dr. Spencer that looks at them. But these girls are in bad shape. They know. They're the ones that diagnosed her. They're the ones that told me what was going on with them. Somebody should have said, okay, this should be a priority because they're of their age. They're getting older. They are experiencing pain. They were. And she didn't do a damn thing. I know you're going to see this, Dr. Spencer, and I'm going to look, because if she goes, if Misha goes now, because I just put my hippie down yesterday, if I have to put my girl to sleep, you're going to hear from me. You're going to hear from me and probably a lawyer. And not only will I come after Pulaski Animal Hospital, which is not a hospital, it's just a clinic. I'm going to go after you too, Cheryl. I'll hit you with a civil suit. And you're going to be sorry. You are going to be sorry. So now I got to wait. Yeah. Alright, I gotta end this because I gotta attend to Misha. I don't know what I can do for her because it's 8:21. I'm gonna call. And I'm gonna take her in. Look at this. I was gonna shut the video off and the video's on the damn disk cap.
It's just horrible. Knowing that she needs help. Oh my God.
Yeah. So now I'm watching her. I can't. She's like shaking right now. Misha's shaking. I'm watching her.
Dave, I take her.
I am. I'm gonna have to. I can't take her to. I can't call the hospital right now because they're not open. But I'm gonna call my neighbor across the street, see if he can take me, and I'm gonna see if I can get her some antibiotics, and then I'm gonna. God help.
And if I had any antibiotics left from Wrigley, I would have gave it to you.
No, I have to. I understand, but no, I got to see because I don't know with her kidney failure. Whatever medication could cause more damage, and I don't know what the extent of.
Jesus, Dave.
I'm going after him, and I'm gonna go after this Cheryl.
Yep, I fucking demand her. She should be fired. She should be fucking fired. That fucking no good, dirty bitch.
No,
That's all she is a fucking cop.
I,
You know what? I would have to ream her fucking ass out, man.
Beth, right now I gotta focus on her.
Fucking ream her out.
I need to focus on Misha because you know what?
You do, Dave.
Okay, look at it. I'm watching her. She's poor thing. She's jerking. All right. So I gotta take two.
Keep me posted, would you, babe?
Yeah. Right, bye.
Okay, bye.
I didn't start. I shut the video, my desktop video off, and I called my friend Beth, and I wanted you to hear how she responds and how she feels. It's the same as I do. A lot of negative reviews on Google concerning Pulaski Animal Hospital, as far as not returning calls and Cheryl Drasky, office manager. I've seen I think 2 that address the person who's running the office there, and that's Cheryl Drasky. And they described one as an older, rude woman that works there, that runs the office. That's Cheryl Drasky. This has gone on for years with me and her, back and forth. I didn't let it bother me because at that time my girls were in the shape that they are now. Now, I have a condition. you know, my health is like this right now. This is affecting my health. It's affecting me. If something happens to her now, I can tell you how I'm feeling right now. My insides are like this. I feel like my whole body's going to explode. I feel weak. I have a hard time with my balance as it is. Right now, I can't walk straight. I'm shaking so much, I can't even maneuver, right. I can't use a cane when I take her out because there's times I have to carry her back. She can't walk. So I can't do a juggling act. I'd rather, if I fall, I'd rather fall on my back while holding her than to just have her walk and worry about concern myself about my well-being because she's my everything now. No, not Pulaski Animal Hospital. At one time, they were a great hospital, but ever since they remodeled, they got their place looking really nice. Yep. Lack of concern. Sometimes it seems like it leans on the edge of arrogance. I feel sick right now. I feel sick. I gotta call my friend.
I just want you to go more in depth about the situation once again. Like, what exactly did you notice, and
Okay.
like, when did they start doing that?
All right, it's Fernanda. I'm sorry.
Yes.
Okay, as I said, Fernanda, when all right, I got to get my head straight. I got to think straight. Just a minute.
Okay, yeah, no worries, it's fine.
Okay. I noticed that there was a problem with Misha. I brought Misha in, and here's another thing. We did a test on Misha on a Friday with Dr. Collada. He told me the test results won't be in till Monday. So I waited that Monday. Now this is probably 6-7 weeks ago. I called to find out the results. I couldn't get through to you guys. When I got through to you, they said, well, Dr. Collada's not here. He's the only one that could, he'll give you the results. So I said, well, is there anyone else there that could give me the results? And they said, no, it's got to be from the doctor. So from that day, from Monday, it took me all the way to the end of the week, Friday, to get Misha's test results. And I had called numerous times through that week, and I was getting frustrated, saying, you know what, somebody's got to be able to do it. And I said, ask Cheryl to do it. I mean, she's an office manager. I'm sure she's got some leeway. She has access to Misha's results, and she does. I know she does because she said she looked at them. Nobody. I found out Friday that her kidneys were failing. I had to wait till Friday to find out that my girl's kidneys were failing. Maybe if somebody would have given me the results on Monday, I would have known. So when I brought Hippie in after I brought in Misha, Dr. Collada, it was concerning a fatty lump on her outside. It ended up to be a fatty tissue. But from that point on, I noticed that there was a change in their normal everyday activities, the way they did things. So Hippie 2 weeks ago had a seizure on a Thursday. I called Friday and I said, I'm concerned, and I don't know who I spoke with, and the girl said, yeah, this is something that you need to bring her in on. And then when I called to bring her in, they said, well, no, we can't see Hippie because we're busy. The girl recommended an ER room, but I didn't know she was going to send me a list of places for me to take her. And then, but when I realized that she had texted me a list, these places were nowhere near me, and I don't drive. So at this point, I noticed Hippie was in pain. I came in and I made it clear that they had to see her right there and then. They said, okay, bring her in. I had to go back home. I brought Hippie in. Dr. Collada looked at her. Dr. Collada did an ultrasound, and he found a tumor in her stomach. And he said it was a very large tumor. From that point on, I decided that after they did the blood test, because they didn't know if they would be able to operate on her, but because the blood test showed that she had toxins in her blood, that there was nothing they can do. Plus, they found out that Hippie's kidneys were failing. So I took it upon myself to, give Hippie the same treatment that I'm giving Misha with the fluids under her fur. Now, I don't know if these treatments that I'm giving under Misha's fur is causing this, but it's supposed to be just that saline electrolyte solution, so I don't know if that would cause it. But I'm thinking because her kidneys are going bad now. Now, from that time on, with Hippie, she started experiencing more problems. And when I would try, and every time I tried to call to give an update, and I know you guys are busy, but there's no one that picks up. Now, somebody did pick up on one day that I was calling on regards to Hippie, and I noticed this time it didn't go straight to voicemail. The phone rang twice, and then it disconnected. I called again. The phone rang again. It disconnected. I called a third time. It disconnected. So, I know I've asked in the past, because every time I call, you guys would always ask, what's a good callback number? I would give it. I finally, Thursday, the girl said, when I called on Hippie, she said, is this a good callback number to call you on? 708, and I said, wait a minute. I said, you know my number? She goes, yeah, I'm looking at your file. And I then asked her, do you have caller ID? Now, you guys got caller ID, I know that, because I found out yesterday. She goes, yeah. This tells me that all these other times that it goes straight to voicemail or nobody picks up is because either they know who's calling, because I'm calling frequently on these girls, and they're not wanting to answer, or they pick up, and then they realize they picked up on me, and they disconnect. But I was told before that they didn't have my number, on file when I called, because that's why they would always ask what's a good callback number. If you have caller ID, then why would you ask a client what's a good callback number if you see what the number is right there?
Yeah, I understand.
Okay, so Monday of this week, these spasms with Misha started occurring, I noticed, probably several days before Monday when I sent the video. But it was that Monday that these spasms became more severe, they just gotten worse. So, what time do you guys open today? I thought you opened at 9.
We do open at 9, but these are Dr. Spencer's appointments that he's...
Oh, okay. Oh, is Dr. Spencer there?
Yes, he
Would
is.
you please tell him what's going on? And tell him that I'm going to be addressing, because I'm going to tell you right now, I'm putting total responsibility on Cheryl Drasky. That's her maiden name. I don't know what her married name is.
Yes.
But you make it clear to him that this is a problem, and whoever these people who are putting the reviews, some of them are addressing Cheryl directly.
Yeah.
And then Cheryl had the audacity to say hello to me and waved and hi after Hippie was put down. I'll tell you, it's a good thing that I was there for Hippie, because you don't want to know what was going through my mind when I saw Cheryl. I'm disgusted with her. I am completely disgusted with her. Had she addressed this issue with the videos sooner, maybe I could have brought Hippie, if she would have said, yeah, it's time to bring her in. Or if maybe Tuesday, somebody could have given this to Dr. Collada and have him look at him maybe they could have said, yeah, it's time to bring her in and say goodbye. I would have brought her in sooner than later. And then maybe this issue with Misha could have been addressed sooner, because now this discharge is terrible. It's just started now. We could have caught this sooner on Monday had Cheryl responded. And if she did respond and looked at the videos on Monday, there's no excuse why you could not have addressed it and called me, or if not, relayed it to Dr. Collada to have him address it and call me. I know Dr. Spencer's busy, but let him know. I don't care. I'm going to bring in Misha, and if he wants to talk to me, I'll be more than happy to to let him know what's been going on. Because if she dies, I'll get a lawyer. I'm getting a lawyer, and I hate to say this, but it's Pulaski Animal Hospital's responsibility to make sure that whoever's in charge is doing their job. Right now, she can't even walk. She takes she walks like someone who had an accident in their pants, and she moves slowly. I have to carry her now. This affects my health. I got a lot of things going wrong with me, and this is elevating my health condition.
I understand. That it's been going on for a while, and especially if we don't get back to you. So I understand you're frustrated. I do understand. I'm not exactly quite sure what exactly happened when they took care of you. The most recent phone call that you made this week. I'm aware of it right now, that everything you're explaining to me. So I will communicate with my coworkers to see what it is that went on, and I wish I could be able to speak with her, but unfortunately she's not here with us today in the office.
I don't want to talk to her, Fernanda, because I'm fed up with her. I am done with her. This is going on for years with her. And I think I know what this stems from. At one time, you guys would honor competitors' prices on medications. So I used to get their heartworm medication from you guys, but then I saw that I was getting ads from other pet med suppliers at a lower price. So I asked Cheryl, "Do you guys match prices?" And she goes, "Yeah." She said, "Yeah." So I asked her, "Would you match this price?" She goes, "Well, I got to verify the ad." And that's what she told me. As long as it's if they're advertising it for that price, yeah, we can match it. And that's what she's been doing. 3 seasons that I get their heartworm medication. That's what she's done. That's what she has done. Given me, she's matched their prices. But then, I guess she was tired of doing that, and she said, "No, we can't. We can't honor it anymore, especially with the Apoquel." That's fine. But since that time, I noticed the manner that she deals or talks to me and deals with me is she doesn't respond, or if she does, it's days, if not a week later, that she will finally call me. Now here's one more thing. When I had called one time, I can't remember exactly. I think I'm sure it was for Misha. I called her, and the office staff said she was busy. I said, "Okay, I need to speak to her. Could you have her call me back?" They said, "Yes, we'll have her call you back. I'll tell her right now." I waited until 5:30 that evening. She did not call. So the next day, I called. I finally got a hold of Cheryl, and I said, "Cheryl, did they tell you that I was waiting for you to call back yesterday?" And she goes, "Oh yeah, well, and this is what she tells me. She told me, "Well, I was here in the office till 9 in the evening. I had your message." And I said, "Well, why didn't you call me? I was waiting." She goes, "Well, I saw the time and I didn't think you answer the phone because it was so late. Well, I never heard of such a thing. I don't know if if she was telling me the truth, if she was there till 9, but this is what she told me. So, yeah, if you're there, call me. I don't care, because I'm calling you because it's concerning my girls, not me. I don't want to just talk to her. Okay, so I gotta find a ride to get my girls there. My girl now. I don't know.
I'm sorry. Is it okay if I put you on hold?
Sure.
In a quiet room?
Yeah.
Sorry.
Yeah.
Thank you.
It's an annual fecal exam and annual vaccinations for your pet. Exams screen for internal parasites and diseases, while vaccinations can save them from those that are avoidable. Remember to bring in a fresh stool sample for testing at the time of their appointment. To schedule your pet's annual exam or vaccine.
Sorry about that.
That's okay. You know what? As a matter of fact, if Dr. Spencer's there, I want him to look at Misha. Because I want to
Dr. Spender.
Yeah.
Let me go ahead and open up your account so I can go ahead and tell him that you want to go out.
And explain to him what is transpired about Cheryl and Monday. Because now because of her not responding, my one girl I had to put down suffered. She suffered since Monday.
How long ago did she start trembling?
With me, I noticed her front paws trembling on either Wednesday evening, because it would have been my Bible study night. Wednesday evening. But it was her front paws. They were trembling. Now, Misha's the type of dog that doesn't make a sound when she's in pain. You have to know her body language, and I recognized it.
Yeah. Okay. And then, once again, you said fluids were coming out, correct?
I'm sorry? With Misha, this morning...
I'm sorry, yeah, with Misha.
With Misha this morning, last night when I removed the bedding where Hippie used to lie, I decided I was going to wash Misha's bedding. So Misha sleeps on a dark-colored red fleece cover, and I have underpads underneath in case she has an accident. When I removed Misha's bed covering, there was blood all on the bedding. So that was last night. I put fresh pads down, but I didn't throw a blanket over that. I left the white side up on the pads, so in case I saw maybe she was leaking at night, I would be able to tell. Well, this morning when I looked at her pads, it was discharge, yellow urinary, like a yellow discharge. So I'm thinking, from past experience, it's like a urinary tract infection. But this is really, really bad. Yeah. It's dripping out of her, and it doesn't seem like she can. Her back, her rear area is like in pain because it's spasms.
Okay, got it. Okay, let me go ahead. I don't want to hang up. I want to keep you on the line. Let me go ahead and talk to Dr. Spender about this whole situation, and or I could either put you on hold, or I could give you a call back since I'm taking care of the situation.
Fernando, do me a favor. Please call me back because I got to find a ride. I got to get a ride, but I'm bringing her in.
Okay.
All right.
So once again, let me just confirm the phone number: 708-308-6331.
Yes.
Okay, so that's the phone number. I'm gonna give you a call. For Misha, and this is David Ortiz.
Right.
And once again, just to confirm, you do not want to see Dr. Collada, you want to see Dr.
Dr. Collada's not there today, right?
He actually isn't.
He's not.
He is in.
Oh, he isn't. But normally he's not, though,
yeah.
Right?
Yeah, no, he's usually not in on Saturdays, but today he isn't.
You know what? I think I should, I should address this matter with Dr. Spencer because I know he's the owner of your establishment.
Okay. Okay, so I'll go ahead and give you a call back then. But we should be expecting you to come in today.
Yeah, soon, very soon.
Okay. Okay.
All right, thank you.
All right, then let me go ahead and take care of the situation.
All right, thank you.
No problem. Bye bye.
Misha, I'm taking you into today. I'm gonna get this urinary tract thing going. I'm gonna have this fixed. That's a problem? Hi. Hi. Listen, I need your help. Are you working? Are you busy right now?
Yes, I'm working, but I can have a few minutes to talk.
No. I need someone to take me to the animal hospital on my girl. I had to put one of my girls down last night. And now this my other one is there's something going on. I need to find somebody. Do you know of anybody that can give me a ride?
I don't know, but I can ask around. He said, he made some calls and then I'll let you know right now.
Alright, please, because I think I will come back and put my girl down yesterday. No, I wish I had put this back.
Okay, let me call right now and I'll get to you as soon as possible.
Alright, thank you.
Okay, yeah.
Don't worry, we're going to address this matter.
Your call has been forwarded to an automatic voice message system. 312280501 is not available. At the tone, please record your message. To have finished recording, you may hang.
Hello, Sergio?
David,
Hi. Listen, are you working today?
no. I'm not
I
working.
need your help, Armando. I need you to take me to Pulaski Animal Hospital. I got to take Misha. I had to put Hippie down last night.
Uh-huh.
Hippie's gone now. Now Misha is sick. And you know what? Can you please take me now? And I'll tell you. I'll tell you everything that's going on. Just don't even know how to go. I am so mad right now.
I will stop you in your house about in 10 minutes.
Okay. Okay.
Okay, be ready. Okay.
All right. Thank you. All right, Michelle. Okay, I'm sorry. I had this video running. I'm gonna address this when I get back. I don't know how much I was able to record on my documentation. This is from my personal records.